ABC News exclusive. Doctors in North Carolina are studying a potentially game-changing procedure that targets obesity at a hormonal level. They're due to present their findings later this month, but Ariel Resniff has a first look. Good morning, Ariel.
Good morning to you guys. This is a limited study, but it's still extremely exciting. The team behind this minimally invasive procedure says it has so far been successful for patients in a preliminary study, with most experiencing weight loss. The doctor's hoping to broaden the scope of the trial and touting the procedure as a new and potentially groundbreaking advancement in the fight against obesity.
This morning, the medical team behind a clinical trial for a possible new weight loss procedure says it has the potential to be a game changer.
For patients who might be afraid of surgery, this may be more acceptable.
It's called endoscopic ablation, and here's how it works. The doctor inserts a camera into the stomach while the patient is asleep. Fluids are administered to protect the underlying stomach tissue before a tiny device ablates or burns the lining of the upper portion of the stomach that produces ghrelin, the so-called hunger hormone that can trigger appetite. Dr. McGowan says in a limited study of 10 patients that it has resulted in decreased appetite and weight loss.
We do have patients who are a year or more beyond their initial procedure, and what we are seeing is that they continue to have a diminishment, decrease in hunger, continue to report greater control over eating.
Brooke Nelson is one of the first to have undergone this trial. She says the results have been nothing short of remarkable.
The constant just wanting of food has drastically decreased. There's still moments where I want a chocolate chip cookie, but there's a lot more moments when I find myself wanting something like greens.
Nelson losing 26 pounds over 6 months. Dr. McGowan says the results of the study indicate on average that patients reduce their overall weight by 7%.
Today, I'm at 183.
And while the new procedure offers a non-surgical alternative to gastric bypass surgery, in which portions of the stomach are reduced in size, like any procedure, it does come with risks.
Risks of this technology could include things like ulcers, bleeding, somehow injuring the stomach. These were things we were really careful about. In this case, everything was mild, and that was the cramping and gas and nausea, things you'd expect when you'd perform a procedure on the stomach, but there were no complications whatsoever.
And Nelson says this procedure is not a shortcut. It's just a tool to help. It is still very far from being approved for wide use. This study was limited, and at this point, it's little known about the long-term safety and results. It's also unclear if it would be like a one-and-done solution or if you would have to repeat this over time. But certainly, we see this ever-changing and expanding landscape for weight loss, and it's very exciting.
It is.